we have a lot of questions for you. I think we could spend the next 2 hours with the questions that we have from your talk.
Oh, well, that's good.
Which
Curious
I
people.
think I can't imagine anyone not having, the feeling that this topic impacts them, because it's important for us all. We're all trying to live lives in motion, and much gets in our way. And many of the questions we have here are relating to that. So the first one is, someone just wants to know, are you seriously saying that genetics are not our destiny when it comes to function and health span? I'm going to let you comment on that.
Oh, absolutely. By far the most important part is what's called your epigenetics, the expression of your genetic code that you bring on by what you do, what you eat, how you move, all those different things. And that is going to be far more important than the lot you were given at birth. Maybe you're not going to be a 2-hour marathoner, sure, but that doesn't mean you can't be the healthiest version of yourself. And for me and most of the people out there, it's probably a little healthier than we are now. So keep working on it.
So it sounds like the question is, it's a value to start wherever you are. The next question is really about, does committing to exercise really make a difference at any age, or is it only for young people?
I could argue either way, that when you're young, you're setting yourself up to have a higher baseline fitness, which automatically is going to give you a better fitness as you age. But you could make just as strong an argument that starting an exercise program at 75 is going to make massive increases in your ability to function on a day-to-day basis. I think it's critical at every age, and obviously you're going to have ebbs and flows throughout the years, but we just got to do our best the whole time.
So Judd, so how should one view developing an exercise plan differently, whether they're young or older?
Well, kind of like I mentioned, the first thing is figuring out where you are, meeting yourself where you are, right? If you're already pretty active, you can start off with a little bit more vigor. If you're relatively sedentary, you just need to start with the basics, start getting up and walking more. But it really is just meeting yourself where you are, regardless of age. The only thing I can really add with respect to age is the older you are, the more you really need to pay attention to your ability to recover, because it is going to be diminished relative to when you were younger. So be patient with yourself. Give yourself a little bit of extra time to recover between your activities, and you'll be fine. But you can start anywhere, any age.
So exercise, is still, it's the same exercise that we may have done 100 years ago, but one of the big differences is that we've got a lot of biometrics now, and people are monitoring themselves. And so one attendee asked, what are the most important things to focus on and prioritize? Are they steps, calories, sleep, pulse? Maybe even glucose? People are monitoring their glucose now. What should people start focusing on and build to?
So I may have a different answer than what they're looking for here. And my first answer is, all these things you can measure are wonderful. They're amazing that you can do all this. But the end result is that you should be in touch with your body. So you should learn how to feel how your body is feeling and how your body is reacting to these. So if these tools help you along the way and help you measure and help you progress, great. Have a pedometer on your wrist, whether it's your Apple Watch or your Fitbit or whatever it is, to help you gradually build up your steps during the day. For the most part, though, I'm more old school, like you were saying 100 years ago. Like, to me, it's less important the specifics and more important that you're just doing something. You're getting up and moving. You're picking up something heavy every once in a while. You're moving quickly every once in a while. And I really feel like if it helps you to achieve your goals, use the step counter, use the fitness watch, use the heart rate monitor. But I don't think we need to chain ourselves to those in order to be physically active and fit.
So Judd, apropos to that, one of the attendees asks really the follow-up question, which is, what should I be focused on if I begin exercising and I'm sore or in pain? What should I do? Does that mean I should push through, or does that mean I should stop?
I think if it's pain, yeah. If you're a little sore the next day, that's pretty normal when you're getting started. But if it's actual pain, let's slow down a little bit. Let's work on your movement quality, right? Like I talked about the mobility piece. And don't go crazy with it when you're just beginning. Be patient with yourself. Really work on your mobility, your stability, your balance, your ability to move well before you worry about loading it and doing all the hardcore stuff. You
And
move well first.
And Judd, I'll stress what I think, I'll say the words that I think you were getting at, which is pacing and incremental steps, right?
Yes.
With that, people come to exercise with other comorbidities, other disorders and diseases that they might have. So I'm assuming you would suggest that if they have issues, they should touch base with their physicians, their caregivers, and make sure they're safe to exercise.
Pretty sure every single exercise program you ever see anywhere starts with, please consult your physician before beginning any exercise program. But I also want to emphasize this, is that no matter what is going on, you can most likely find a way to be physically active and work around whatever those restrictions are. And I don't want people to think, oh, I have fill in the blank, therefore I can't move at all. And even people in the weight room, like, oh, I hurt my knee, so I just stopped lifting. Well, what about the other, muscles on the rest of your body? But, you can find a way to move, to be physically active. And you may need some help with and some guidance to get there through your doctor, through your physical therapist, whatever, but don't let it stop you.
And I think you'd agree. Just know that there is a place to start and a way to get moving for almost everybody, no matter where your starting point is. Now,
absolutely. But I would also want to emphasize that you want to, again, if you're trying to be the best physical version of yourself, whatever that means for you, it's going to have to be progressive, right? So if you're like, oh, I can only do 1,000 steps a day right now and I'm worn out, great, start there, but don't stop there.
So in terms of your comments about chronic illness, this person attendee noted that it's clear that exercise can help hypertension and diabetes, but what about other disorders? And the one they're interested in is really infectious diseases, and I would say immunity. What are the other benefits of movement?
So absolutely, you will improve your immune system by being more physically fit. Whether it is simply just conditioning your mitochondria to produce more energy, it's going to help feed your immune system to function better. When you have better physical fitness, you have better immunity. If you go too far overboard, like tomorrow we've got the Sacramento Ironman, right? I bet there's a lot of people, myself included, that might classify that as maybe a little overboard. But if you do that too hard, too much, too often, you can go down the other side of the slope and affect your immunity. But for the most part, just about every disease risk we can think of gets improved as you get fitter, as you are more physically active.
Judd, what I've heard is that what I've seen from the data is that physical activity really reduces every form of morbidity that we know of from chronic illness.
And my understanding is oftentimes it does a better job than any medical intervention we have.
That's right. So with that, one attendee asks, what's the best time to exercise? Is it in the morning? Is it at midday? Is it the evening? What are your thoughts about that?
Number one, far and away, what works best with your schedule, right? Where does it fit in? Where are you most motivated to exercise? Because that's going to be a major determinant on whether or not you're able to stick with it. If I can tell you the best time to exercise is at 4 o'clock in the morning, it's probably not going to work out for a lot of people. If you get into the literature, they'll show you that for higher level athletes, you're going to get a better response for cardiovascular stuff in the morning and better power, strength, and sprinting in the evening. But honestly, it's what works best for your schedule. I would hate to have, perfect be the enemy of good.
Let me ask you one last question before you go. Someone notes that they have a knee injury and their injury keeps them from getting started exercising. When you already mentioned, that we all have aches and pains and problems one place or another. How do you get around those?
So, again, consult your physician, see if there's something that they can help you with to fix that up. So if we start working, take the knee, for example, if we start working on your mobility, your stability, the strength around the knee to stabilize it better, you may find it starts to function better, and then you're able to move around and do those activities better. But if you aren't, maybe you find something different. Maybe you're doing exercise with your upper body. Maybe you find a modality such as riding a bike or something else that doesn't bother your knee that allows you to do those things. But again, starting with the function first and addressing the injury, I think is the best way to go, rather than saying my knee hurts, so then I can't do this. Well, let's work on making the knee better and, maybe strengthening it and the rest of your body along the way.
All right, Judd. Hey, we could go on for hours with these questions, so we need to conclude. I want to thank you so much for your presentation. Judd Van Sickle is the director of our Performance Center here in Sports Medicine at UC Davis, a real expert on this subject area. Judd, thank you so much for being with us.